Hello, welcome everyone. Welcome to the first Impacting Policy series of 2024. This is, as we've talked about, a joint venture between the Institute for Health Policy Studies and the Impact Program, both of which share the mission of really helping everyone across the UCSF campus to enhance their skills in disseminating their work and impacting the policy process. We're thrilled to be launching what is the start of our third year of doing this really successful series, and we are launching it with what is a very popular and often requested topic, which is how do you actually get funded and promoted for policy work? And to talk about that, there will not be any slides today. It will be much more of a conversation. To talk about that, we have three wonderful panelists who are joining us, many of whom you probably know, Dr. Hilary Seligman, Dr. Beth Mertz, and Dr. Krista Harrison. As a reminder, please put any questions that you have in the Q&A, and we will save about 15 minutes at the end for questions. But feel free to put them in as they arise so that you don't forget them. And if I get a chance, I may ask them kind of in the moment if it's a follow-up to something we're discussing. And also as a reminder, all of these sessions, or almost all of them, are recorded and available on the IHPS website. And so if you want to see any prior sessions, feel free to check them out there. But without further ado, we'll go ahead and get started. And I decided to spare us the more formal bios and to ask each of the panelists to just tell us a little bit more in their own words, what they do day to day, what their work is about, and then we'll delve into the funding and promotion piece. So it's okay, I'll start with you, Hilary.
Dr. Griffiths, this is Janet Kaufman, our co-associate. Just reminder to our audience that we have a Q&A forum for the webinar. We don't have a chat, so please put any questions and comments in the Q&A forum.
Perfect. All right. So Hilary, I'll come to you first to just tell folks who don't already know a little bit about what your work entails.
Yeah, my name's Hilary Seligman. I know many of you on this call. I'm a professor in the Division of General Internal Medicine. My research focuses on food insecurity and health outcomes, and my policy experience is centered around food as medicine interventions and federal nutrition programs like SNAP and WIC.
Beautiful, thank you. And Beth, I'll come to you next.
Hi, everyone. Beth Mertz. I'm a professor in the School of Dentistry in the Division of Oral Epidemiology and Dental Public Health. I also serve as the Associate Director for Research at Health Force Center. And my work has been primarily focused around the health workforce with topical area around dental, oral health issues, and also health disparities within the and access to care within oral health.
Beautiful, thank you. And Krista?
Hi, I'm Krista Harrison. I'm an associate professor in the Division of Geriatrics in the School of Medicine at UCSF and also in the Institute for Health Policy Studies. I am a social scientist and my work over the years has spanned a number of areas. My research currently focuses on how to mitigate suffering associated with aging, dying, and grieving. And most of my work specifically focuses on people with dementia and hospice policy and care.
Amazing. First, before we get into talking about how your work is funded and how the policy piece in particular is funded, and then we'll come to promotion next, I want to talk first just a little bit about what is it that you actually do to interface with policymakers? How do you reach policymakers? What does that look like in the day-to-day or the month-to-month? And I'll start with you, Beth. That's okay.
Sure. Okay, so wait, say this question again. I wasn't expecting.
Yeah, what does your interfacing with policymakers look like? And how do you actually disseminate your work to policymakers when it's appropriate?
Yeah, absolutely. So, I mean, there's always the formal opportunities where you're asked to present on your research at like a briefing, whether that's actually at the government or through advocacy groups that are hosting it. I've recently been able to present to the Workforce Education and Training Council that the state of California has put together to advise HCI in their workforce investments. And that was about a 3-hour presentation and discussion with advisors and policymakers. So that was a really great opportunity. Those really do come, I think, those opportunities don't come that often. So much of the work is really done through policy briefs and other dissemination that distills down the research into more actionable and easier sound bites, so to speak, in terms of getting the information out there. So, for example, with our Workforce Center on oral health, we will do journal articles, publications, infographics, various things, and we always usually have a 1 or 2 page brief that we can then circulate related to that. There's also a lot of philanthropy that is really interested in policy change, and I've been fortunate to be funded by a number of those organizations. And sometimes from the very outset, that work is focused on policy change, and so the research is very much directed on informing that. So there's a lot of different ways that comes together.
Yeah, beautiful. And we'll get to the funding next, but let me ask, Krista, how do you actually disseminate your work to reach policymakers?
Sure. So it's varied a lot over the years. I worked at Mathematica Policy Research before any of my doctoral training. So that was a lot of writing government reports for the contractors, I later wrote policy briefs for a health policy journal. In general, I've tried to ask questions and frame the discussion sections of my research studies so that they are relevant for policy change or speak to what could be changed. But then particularly since being at UCSF, there have been opportunities like sitting on a CMS technical expert panel and giving feedback about a quality metric that ended up changing how we bill for home-based medical care, which makes it more visible to researchers. I've had things that have gotten some thought pieces that got some attention from policymakers. And so that's been, even though they were in academic journals, got a little more attention than otherwise. And then most recently, I was able to present to the National Alzheimer's Project Act Advisory Council, which has representatives from agencies and policymaker staffers and those kinds of things. And then I'll say one of the things I'm trying to do, because I want to make sure that I'm, in some ways, all of those efforts feel distal to the true policymakers. So the Impact was launched a UCSF science policy and advocacy leadership program. And so I got to be in the inaugural class of that. So I'll be learning more and reporting back.
Exciting, exciting. All right, and Hillary, how is it that you, in various different ways reach policymakers?
Yeah, at this moment in my career, there's a lot of momentum behind the work that I do right now, but mostly the policymakers come to me, and that has been phenomenal because that's when you can be most impactful. But why are they coming to me, and how did I do those first steps if you're just starting here? First of all, my research, I try to make really policy relevant, as Krista said. But then my starting steps were 2. One is I partnered really closely with advocacy organizations, and they knew how to reach policymakers, how to talk to policymakers, and they took me under their wing and taught me how to do that. So I think if you have a professional organization or an advocacy organization that's working on similar issues, key partner for you. And then the other way that I really started this work locally was by showing up to citywide policy forums that were open to the public. So for my research interest, this was the City and County of San Francisco's Food Security Task Force. I started showing up every single month and being part of solutions. And then ultimately, the people in that organization started asking me to do things that could be of service to them.
Beautiful. So let me follow up, Hillary, and then I'll come to Beth and Krista. How is all of that funded? So are you showing up on your own time? Are there, ways in which that, you have had some funding, whether that's through philanthropy or, more traditional grant funding, or, whatever it is, in order to actually have some time to start to build those relationships with advocacy organizations, to show up to those meetings, to, whatever it is.
Was that for me? Oh, yeah. So to be totally transparent, I think a lot of this was unfunded in the beginning. However, I do think that this work gives you the national reputation and the access sometimes to funders that allow you to get the next grant that has paid off in the long term. So I think a lot of the opportunities I've had will come because I've showed up in these spaces previously. So I think I put in a lot of unfunded time in the beginning, and I would count that towards my grants because whenever I had a really policy relevant grant, then I felt like I could sort of bill my time to that grant. And this is all sort of hand waving anyway, who's paying your salary.
Yeah, makes sense. Beth, I'll come to you next. I know you mentioned that there have specifically been some philanthropy funders that are interested in that work and would love to have you expand on that, maybe for the benefit of our audience, of who those folks are that tend to be interested in funding policy dissemination work.
Yeah, absolutely. So for example, Pew, I'll just use the Pew Charitable Trust as an example. They have funded our work over the years. And the Pew Center for the States, like the work that they do is really focused on legislation and policy change and adoption. So the research that I've done for a number of projects through that, although they're the ones really doing the advocacy or they're funding the advocacy itself, we're informing that with the research and the evaluation work that we're doing. Similarly with the WK Kellogg Foundation, we had a big grant from them. They were really interested in spreading dental therapy, which is sort of a primary care dental provider. We now have them in 13 states around in the US and primarily in tribal communities, but it's akin to a physician's assistant or a nurse practitioner in primary care, but for dentistry. You can imagine the American Dental Association was not keen on this. And so the research that we did was really looking at implementation of that state by state and how it was rolling out to then inform other states that were looking at adopting that type of a policy. So I do think, not as much with NIH grants, but definitely with HRSA grants, which I know a number of us have a lot of, those grants often have a very clear, informing whether it's doing program evaluation or research to inform their programming administratively. That's another way that you can get funding to directly inform the work. But the private foundations, Pew, Robert Wood Johnson, Kellogg, I've had funding in the oral health area from West Health, Arcora, CareQuest, lots of those groups, like they're really looking to make changes in the environment to improve the environment for better access, better equity, et cetera. So it's sort of baked in from the beginning when you do research with those kinds of funds.
Amazing. Krista, I know you're a little bit earlier on in the process, and sometimes funding is a big source of stress. And I know many of our attendees might be in a similar situation. So I'm curious if you have found funding sources yet that fund the sort of work that you describe of policy dissemination, or if it's sort of something that you're just managing to do through going above and beyond.
Yeah, thank you. It's such a challenging question because there are so many things we do as unfunded labors of love early on in our careers. I think they're particularly across the IHPS faculty and affiliates, and staff, there's been so many great examples of people being really creative in how they tie their policy endeavors into their aims that the funder really wants to do. So I'll say Sarah Garrett has been somebody who's been really effective in her K work, still finding ways to do advocacy and policy, or particularly policy oriented work, even within the realm of her K. And then Elena Portocolone gave me an example of writing into the aims of an NIH grant making recommendations for policy change. So I am, knock on wood, fingers crossed, salt over the shoulder, hoping that the NOA for an RL1 will arrive quite soon. And the third aim of that will be to generate practice and policy recommendations for improving hospice and end-of-life care for minoritized older adults who are experiencing dementia and their caregivers. So those are some of the ways that it's been feasible to bake the policy goals into the funder interest in how does this actually impact patient and families' lives and their outcomes.
Can I elevate the point
Yeah.
that Beth made about her doing the research that then the foundation took and elevated to policymakers? A lot of these questions about how you get funded for it is predicated on the assumption that you're spending 20, 40, 100 hours on doing this policy dissemination, where sometimes the most effective way to disseminate the policy is to get it into the right hands of the advocacy organizations who can use their professional lobbyists to do that. And that often is a matter of getting it into the right format and emailing it into the right person. So a lot of this work that takes time is developing those relationships. But if you're spending, hours and hours and hours on policy dissemination, then I might question if you're working with the right people, because if you are going to maintain your credibility as a researcher, you've got to do the research. And then you leverage the experts to help you do some of this policy dissemination. And you jump in for the half-hour meeting with the legislator. That's how this happens ideally.
Yeah. Perfect. Super important point, Hillary. Let me ask about that part of, as you said, so key to have built the relationships. And I think that is often the part that is hard to get started with. So how did, I'll open it to everyone. How have you started, how did you over the course of your career, or how are you starting to build and to further those relationships? And anyone can feel free to jump in.
Well, I'll just start because I wanted to, Hillary, thank you so much for that clarification, because I think a lot of the ways that I and the colleagues that I've mentioned are trying to do this is to find the right people to have on scientific advisory boards who will be able to bring this work to the people who will listen, so that our research actually makes it out there, not doing the work, not bringing things to Congress ourselves by any means, or the staffers. And so some of that is figuring out who are the people who are active in the research spaces that I'm interested in, who's interested in meeting. And it's been through working in my broader teams of collaborations to find out who are the right people to connect with at organizations that are doing advocacy, particularly around hospice, end of life. Certainly the Alzheimer's Association has been an incredibly strong partner, and their local chapter heads. So those kinds of places are where I'm starting, but I'm also taking notes of what my colleagues are saying right now.
Love that.
I would say networking is a big part of this. I just meet people, and I like to call on them again, but I also like to offer people things that I can do easily that other people can't do. So for example, someone may ask me, what's the evidence behind SNAP reducing healthcare expenditures? Well, that's something, because I'm a scientist and I have access to PubMed, and this is my area of expertise. I could write out that paragraph in about 5 minutes. And that is of huge, huge importance to somebody in policy, that this isn't their expertise. And it helps us establish that relationship. And they are much more likely than to call on me again when some SNAP policy question comes up. And so it is a little bit of finding those areas where you can be very easily helpful, because it's really in your wheelhouse. And again, meeting people and following up with them has been a part of developing these relationships. And also understanding that these things don't happen overnight, that you're in this for the long haul. And so your success, you should go to sleep at night patting yourself on the back. If you had an email conversation, if you got someone new business card, because these are just things that over a course of a long time, some of them will end up being helpful.
Yeah, perfect.
Yeah.
Go
Oh,
ahead.
no, I was just going to echo the things that Kristen and Hillary said. I think those are really important. The other thing is to figure out where the advocacy is happening around some of those issues. For example, is there a statewide, like, for example, when I was early in my career, there was a big statewide access to dental care coalition, and it was a whole bunch of stakeholders that would come together. And I just went to all those meetings and I met people and brought, so that they could learn about what I was doing, what my area of expertise was, or that I was developing at the time. And you can do that both locally, statewide. Obviously, at the federal level is a little harder, but that's also a place where getting the right people to introduce you or put you forward as an expert. For example, I was on an Institute of Medicine committee, actually a couple of them, and that a lot of that was because someone knew of my work and had suggested me as a person to go. So you're really working your networks, and then also, but outside of just the research, because if you want to affect policy change, you got to figure out who's doing the lobbying, who cares about what. Sometimes the professional associations are really helpful. Sometimes they're in direct opposition to the evidence of what is trying to happen. So you got to kind of walk that line a little bit.
So true. Definitely again, throughout our whole series is the importance of partnerships and building coalitions, and networking over time, and that these things are for the long haul. And I think I'm definitely hearing that again here. Before we turn to talking about promotion, anything else? I asked really about your own personal experience, but other things or opportunities that you've heard of in terms of good funders that really are interested in policy dissemination work that that your colleagues have accessed, or opportunities here through UCSF that you would recommend?
Can I just reframe it a little bit?
Yeah,
Because
totally.
my experience has been, if you are answering a really policy relevant question, the policymakers will come. The challenge is that when we do research that isn't very policy relevant, that nobody is all that interested in policy, that's much harder to get to the policymakers. So I would say the first thing you should do if you're having trouble is make sure you really understand what policies are being discussed, what challenges are being encountered in implementation, and you study exactly that, because there will be policymakers that are trying to fix it and they're going to be really interested in your results. So if you're writing a research grant, make it super policy relevant, and then I think a lot of this will happen without you even looking at it.
And I'll just add one of the other things that we've done a lot of evaluation work, as I know many of you have as well. So that could be funded by state or local government. For example, California is rolling out just big dollars in the health workforce space right now. And, whether it's statutorily mandated or just the agency wants it, all that evaluation work really directly informs policy, but it's also research. It's just not investigator initiated research the way that we think of the NIH grants, but rather you're looking for opportunities to do research and evaluation on real world programs that are actually, that are enabled by policy that then will feed back into whether it's program improvements or expansions, things like that.
Amazing. Yes, I've heard philanthropy is a huge category, actually directly evaluating government programs and then finding a way to sort of bake it into NIH or other national grant funding as well. And I know also, Hillary, that at UCSF that we've had the last mile grant supplements that the Impact program is offering. Do you want to talk about that a little bit?
Yeah, thanks. So in each GRAP cycle, we now have these very small supplements that we call last mile supplements that help you to bring your completed research to policymakers by funding things like the development of the policy brief, actually traveling to DC or Sacramento to talk to policymakers, We are really eager to have more applications because we want to move science into policy more quickly. So check the RAP website for the next deadline.
Perfect. All right. I'm going to turn now to talking about promotion and the promotion process. So before we do that, just so everyone has some background, I would love for each of you to tell us what series you're in and where you're at in the process. And I will start with Krista.
I am an associate professor in residence step 2, but I was adjunct until I hit associate because there are benefits to switching in the Department of Medicine.
Right. Beth?
Yeah, I started out in the in-residence series as an assistant professor wasn't a postdoc, but it was a P30 grant that was supporting me for the first 4 years. And then when I went up for promotion, I did a change of series to ladder rank. So I am currently ladder rank. I'm a full professor, step 3.
Amazing. And Hillary?
I started out as an assistant professor in the adjunct series. I am now in the in-residence series as a full professor, and I don't know what step. I'm sorry.
No problem. That's great. And just a reminder to everyone, feel free to put your questions in the Q&A, and we will save time for them and incorporate them. And so I'm going to start by asking each of you how you've captured your policy translation work when going up for promotion. So that can be sort of more general. That can be, you know, where do you actually put it in advance? It doesn't have to, you know, I know personally I can't remember every category in advance, so it can be more general than that too. And let me start with you, Beth.
Yeah, so over the course of my career, both before I was faculty and then when I became faculty, my work has primarily been funded by HRSA and philanthropy, groups like California Healthcare Foundation, the California Wellness Foundation. As I said, there's a bunch in the dental field as well that are specific to that. And it's really baked into that. So it's baked into the research questions. It's baked into kind of the types of products that come out. And lots of peer review publications, but also a lot of technical reports and policy briefs, things like that, that kind of go in that second level of impact, you know, in your CV. And what I've done is I've really highlighted in my narrative kind of how those things work together. And then I also have a section at the bottom, just sort of impactful presentations. So I've done media type presentations, interviews, you know, with newspapers, et cetera, things like that. So really highlighting the impact piece in that part of my CV at the bottom as well. But it's like, I think it's a little easier for me because so much of it was really directly relevant to that from the start, as opposed to trying to translate it after the fact.
Yeah. Makes so much sense. The more you've sort of thought about it ahead of time, as we were talking about, that making sure that you're answering a question that policymakers are really interested in, that your whole career is in that trajectory. I'll come to you next, Krista.
Sure. So some of it's been under the government and other service category because serving on a technical expert panel fell into that category. Like Beth, I have a number of non-peer reviewed or other reports. They go under other publications for me. So that's where a lot of that lives. And then like there's other creative pursuits that you could potentially use, other creative activities. And then I have, again, like Beth, under additional relevant information, a section on press at the moment. And now I'm thinking I could expand that to have policy impacts in there. But honestly, if your CV sort of accounts for enough of your research stuff, and the research stuff is what academia rewards, that's all that there's incentive to bother to reflect on there, if given that it isn't something that we have to do. I would probably get more creative if I was not having the other academic products that are more traditionally recognized.
Hillary?
I think it's important to say out loud for the more junior investigators on this call that it is not clear how you can use advance to your advantage in the promotions process if you're doing this. And so one of the things that I've done with the impact team is to review a bunch of advanced CVs and look for great examples of how people do it in order to get promoted. You all have access to this behind the UCSF firewall. You can search for it under CTSI Impact Advanced Recommendations. And we have pulled from across the university samples of how people have expanded different components of their advanced CV in order to get promoted when a big percentage of their time at work is spent on policy dissemination. So please download this. Let me know if here's Beth Mert's example. Thank you, Beth, for allowing us to use this one. Please let us know if there's other ways that we can make this helpful.
Perfect. I think that's super helpful. I know the impact team has done a lot of work to develop that tip sheet. And I know I've looked at it a little bit myself. I found it very helpful. Are there any sort of like top line takeaways from that, Hillary, before people get into the details of it, of what you would recommend based on that review?
First of all, the advanced CV doesn't give you one place to focus on the impact of your work and the policy dissemination, but don't let that convince you that the people making promotions decisions don't think it's important. Because when we talk to the people making decisions, they say over and over, even though it's not clear in advance, we do think it's important. So please put it in there somewhere. And then the other lesson we learned when doing this is it's not clear the right place to put it. So just put it in multiple times and put it in anywhere. It doesn't really matter. The people who did this the best were the people who called attention to the impact of their work right next to the research study or whatever. So even on their list of publications, they may say in bold afterwards, this study was cited in a legislative bill, SB 1162. And they put it in bold right next to their research study. And then they talked about it again in creative activities and they put it in government service too. So those are some good take homes.
Wonderful. I think that's super helpful just to think about how to, doesn't matter, put it in somewhere, highlight it as much as you can in both the narrative and next to the publication. And that I have heard that too. Like, I think there is this sort of word on the street that it doesn't matter, but when you talk to the people making the decisions, they mostly do say it does matter. Of course, other things matter too. The primary research matters too, but don't let the clunkiness of advance, dissuade you from actually putting this in somewhere. So in that vein, let me ask each of you what you think we can do to make policy impact work better incentivized in the promotions process at UCSF. And I'll start with you, Krista.
Well, it sounds like Hillary and the impact team are making a great start in telling us how to use the existing tools more effectively in showing our impact. My instinct is always there's two ways, one of which is making it easier to get credit for the things we do in the internal pipelines. But the other piece is just as we get mentorship, as we are mentors, as we peer mentor, reminding each other that the work within the ivory tower doesn't matter if we're not having benefit outside the ivory tower, that otherwise it's just talking to ourselves and just reminding ourselves that the CVs are about promotion and that's so we get our paychecks, but that's not the actual reason we do what we do.
Beautiful. Beth?
Yeah, no, I was thinking, I am not sure. I think that some of it actually, I will just speak from my own experience. So for those that are working in an institute like Health Force Center or IHPS, it's kind of about, it's a big part of about why we do the work. There are other parts of the institution where it's a completely foreign concept, and it may even be scary or challenging or, you know, upsetting in some way. And so I think that also understanding what that, outside of all the great suggestions about the CV and writing your purpose statement and really using those paragraphs to really tie the research and the policy pieces together. Also really educating, whether it's your division chair, your department chair, folks at the dean's office, what have you. It's a mixed bag as to whether those folks think that's important, are going to write you a strong letter, or think that you're doing things that are extraneous to, say, perhaps what they see as a biomedical mission or something else like that. So I think that there's multiple layers of that. And for those at IHPS, it seems sort of self-evident, but then when you step out and you're in a position where you're being evaluated by a basic scientist, because that's who is the current, whatever the position is, right? That can also be a challenge. But I do think it's something that you can overcome, but you don't expect that it's self-evident, that might take some education and some awareness raising in order to help people really see how important it is.
Mm-hmm. Yeah, definitely hearing the importance of having a network of people who are doing similar work, both colleague level, mentor level, all around, and educating where needed. Hillary, anything you want to add to that about how we can do better at UCSF?
There are efforts to codify this more among our leadership, but one of the things I've learned in doing this work is that sometimes the failure is in our, I shouldn't call it a failure, I should use a more delicate term, but is in our leaders' creativity to connect the dots between the work that you're doing, the impact, and the mission of our institution. And I always ask mentees to make that really clear. So, for example, my work with community-based organizations providing nutrition in San Francisco has enabled a UCSF presence in this community, has allowed us to show up in ways that are supportive of existing community efforts. You have to write these things down for them to become clear. And your advance or your promotions packet is a really good place to do it. Or you can, if you haven't written the requisite 30 papers, you can talk about the fact that this paper had a really important impact that ended up changing the experience of how patients all over the US experienced their birthing care, for example. You have to connect those dots by actually writing it down, and that can overcome some of these barriers when leaders just don't understand how that was important for the mission of our institution.
Beautiful. Reminder to everyone to put your questions in the Q&A. I'm going to ask one last question of each of our panelists, which is probably a summary of what distilling what the wisdom that you all have been sharing today, which is really, if a junior faculty member or trainee who is thinking about potentially staying on the faculty really wants to have a policy impact in their career as a researcher or clinician on the faculty, how would you advise them to go about that, to go about the funding, the promotion, whatever else is necessary to be successful on that impact-oriented science pathway? And I will start with Beth.
Yeah, I would just say watch a recap of this webinar. We basically just laid it out. But also find good mentors that have done the work, and particularly if they are also in the kind of topical area, whether if you're doing birth outcome work or you're doing access to dental care, what have you, like finding people who can not just sort of show you where to go, but also make the kinds of introductions to funders and advocates and policymakers that are interested in that issue. So it's really rare that there'd be a topic that other folks are not working on, and not to not be afraid to collaborate both within but also externally to to the institution. A lot of my collaborators, in fact, many, if not most of my collaborators, are actually outside of UCSF, because that's where that network is in the work. And then the final thing I would say is just remember that, you know, your passion for making positive social change, for using policy tools and social change, you know, bringing equity, bringing justice to make our country and make our healthcare system and make our communities better places. I think that drive that brings a lot of us to this work, I think, is really important to remember, and to not, you know, it's not something to hide. It's something that's the fire that you really are bringing in and can help sustain you. And as they do, times get tough. So.
Beautiful. Yes, we're not just here to publish the papers. We're here to have the impact that we really want to have, and that will drive you through the ups and downs. And Hillary, I'll come to you next.
I would say, first of all, the people who are most successful at this are the people who started with the policy, the places where the policy interest is, as opposed to starting with in your sort of intellectual, personal head, this is what I'm interested in studying. And sometimes that's a little bit of a pivot, because traditionally in research, we teach you the world is your oyster, study whatever you want, and then work really, really hard to find the funder. But if you want to be really impactful really fast, I actually think we have to change that teaching a little bit, which is to say, what do people want to fund right now? And where are those policy solutions that people are interested in right now? Because someone has to figure out if those are good solutions or bad solutions. So that's one additional way you might think about starting.
Beautiful. And Krista?
I think in addition to those, another version of what Hillary is saying is figure out where the problems are that people are trying to solve and see how you can be part of the solution. Where are the places where patients, communities, and policy members are saying that there's a real problem that needs to be addressed. The other piece is that depending on where you find yourself, I mean, academia has so many silos and micro silos that you may not know anybody who is doing this kind of work, or doesn't know what rules you can break and how to use the existing systems creatively. I mean, we saw Hillary showed us the way that, for example, to use the pretty unbendable system of advance to be creative with it and show that work more effectively, which I have also taken notes on. So finding your way to the people who are being creative, who are breaking the rules successfully, the quote unquote rules, and having an impact as a result, I think are the ways to bring more creativity to your own work.
Beautiful. I love that. Find your community of rule breakers, so to speak, or rule benders, maybe. And I'm reminded of a story that Ashish Jha told me once, which was he was sort of trying to figure out whether to become a researcher or not, and he saying, well, I don't want to do research that doesn't matter and doesn't have an impact. And one of his mentors said, well, the answer to that is simple. Don't do research that doesn't matter. And so, and then he got started on his research career. All right. So with that, I'm going to open up to audience questions. Great question on hearing about different perspectives and really different approaches depending on whether you're trying to work at a local, state, national, or global level. So I'm going to open that up to anyone.
I'll start. I work originally at the local level and national, and now a little bit, and now mostly national. And the thing for me is I feel like the skills are mostly the same, but because it is so relational, it's about the people. And so really for me, the different approaches are really, you have to have that network. You have to start building that network at the right level. And you have to have a certain level of policy expertise. There's nothing worse than going in and suggesting something to a legislator that is just completely infeasible and makes you sound like an idiot. And these policy issues are really complex. So I would say the different approaches are really that you just have to know the different policy contexts in each space, and you have to know the people. And then after that, my experience has been that the process is pretty simple.
Beth or Krista, anyone else want to add anything?
I was thinking that it's really similar to the rules of implementation science, where every context is different and you have to learn the rules of that context. You have to learn the people whose voices are listened to in that context. And so you kind of have to choose a place to start and spend your time there and then grow from that spot. So whether you kind of have to pick, like, am I going globally, and where specifically globally am I starting at the local level? Am I starting at the state level? And that's where you put your time and energy in building those relationships and see where it goes from there. Because there's no non-tailored approach that's feasible.
Yeah, I think it's like the skills of building those relationships may translate, but the specific relationships may not translate from context to context. Beth, anything you want to add?
Yeah, I mean, I think that, so for example, just using my work in access to dental care, this is kind of a worldwide problem, and there's work going on at the World Health Organization. There's examples from many different countries that having wildly different contexts than the US, and then even state to state within the US, or even county to county within California may be quite different depending on the factors. However, I think that one of the strengths of at least having situational awareness at the multiple levels is that the ability to translate and provide opportunities to say, oh, well, this rural country in on a different continent has come up with this solution, and it actually might really work in one of the rural counties here in the United States. Now, is it politically feasible? Blah, blah, blah. All of those things are different questions, but just having that situational awareness, and then same, a lot of, and as we've seen, California, sometimes counties will really spearhead an initiative and it's very successful. And then, well, that might translate into a more statewide initiative or translate into other similar counties, things like that. Well, which all happens operationally through policy change. So I think that just thinking about the interrelationships of those levels, it doesn't mean you have to be an expert at each one of those, but just having that situational awareness and the ability to translate findings, lessons, etc., from one place to another will come in very handy as you continue to do your work.
Beautiful. I don't see any other questions from the audience. I want to give folks a moment. If anyone wants to add anything into the Q&A, or Janet, if you want to chime in, you're welcome to, but no need to. And if not, then we'll wrap up a little bit early.
Here, I'll turn my camera on. I think, yes, the one question we had in the Q&A was answered. And I guess, I think you've touched on this, but I guess I wonder if each of you all could share let me think about how to say this. And that is, how have you dealt, or what strategies do you have for within the promotion process? Your best advice for educating departmental or school level leaders who themselves are less able, I just see less, or less engaged and interested in policy level work. If you were mentoring one of our postdocs or one of our junior faculty, what would you say?
Well, I would start by saying, don't be afraid to kind of promote yourself in terms of saying, look for opportunities to present your work at lunch and learn type opportunities, or if you have a department retreat, is there an opportunity to highlight kind of the impact of the work or frame some of the questions? So I think some of it can be through those mechanisms, really just interpersonal. It also getting involved with the academic senate and looking at how folks are interacting across different disciplines and different areas across the university. I found has also, I've learned so much from some of the Senate activities, because those are also policy. I mean, it may be education policy or academic freedom policy, but the way that people think about the things, and then also opportunity to educate other people about what you do and how the impacts are. So I don't have like a holistic strategy, but those are some of the things that have worked for me.
Thanks, Beth.
Yeah, thank you. We do have another question in the chat, so I'm gonna bring that forward, which is a great question, which is, how do we actually, as an early career researcher, start to get the perspectives of policymakers really early on in our grant writing? Is it worth trying to engage policymakers as we think about new K or R applications and explore their relevance with them? And how would you go about doing that, if so?
I'm gonna put just a link to one of my favorite articles about this. It is 100% worth it. I think that makes a good application into a great application. And sometimes that is asking policymakers. But I will say you are equally as successful if you talk to the advocacy organizations or the professional organizations that are talking to the policymakers, or oftentimes if you look into other kinds of research, even academic research. So and oftentimes it's like the New York Times. What are they saying in the New York Times? For me, sometimes it's about the food industry. What is the food industry saying about SNAP in the New York Times, in their own sort of conversations about it that are public? Sometimes they write this down in academic articles, and you can reference those articles. So don't feel like the answer to the question is yes, you should be seeking out the impact, thoughts of the policymakers early and often, but you don't always have to do that through a direct face-to-face conversation.
Beautiful. Anything else you want to add, Krista or Beth? I think that's great. Definitely get their perspective, but that doesn't always have to mean that you're actually talking with the elected official, that you're talking with someone who might.
I will just add the elected officials, it also depends on the context, like they turn over pretty, there's a lot of turnover in that, and someone might be an advocate this year and then they're out of office next year, and then the sort of Overton window, so to speak, for that issue has closed for the time being, whereas the advocacy groups have a little bit more sustained effort over time. Some of the groups that I've worked with, the same people have been running these groups for 20 years, or if there's been turnover, it's been one or two directors in multi-decades. And so that building those relationships, because they're the ones who are really tied into, they're doing the work of which one of the legislatures is interested in this, who's on the health committee, who's doing this, who's doing that. So you don't have to do that work, they're doing that work. That's literally that's their reason for being, and so forth. So really just kind of understanding what that landscape is, and not trying to over engineer your grant, but to say, we've got these partners that work in this space, and if this is currently on the legislative agenda, or this has come up 4 times in the last 3 years, in a way where you're sort of making the case for the importance of the work and the relevance.
Mm-hmm. Beautiful. I think that's such an important point, particularly here in California. Definitely we have term limits. And so oftentimes you're going to see more longevity through advocacy organizations or through longtime Capitol staffers who have maybe been the, health committee consultant for 20 years or whatnot, but that the interests of the elected officials may come and go on a timeline that can be quicker than sometimes the K to R pathway and research question pathway. Great.
And related to that, Beth, I just want to piggyback. I think Hillary, you mentioned, Beth, you both mentioned being engaged in meetings of coalitions of advocates. And so I think that's powerful to meet multiple folks from multiple advocacy groups and learn more about their agendas. I also think going to conferences like the Insure the Uninsured Project Conference that's in Sacramento in February every year, Academy Health Policy Conferences, going to some of these conferences that are attended by legislators, staff, executive branch agency advocates, going to those things, learning more about what's on their minds and getting to meet them, that I think that can sort of help you shape your research agenda in a way that, would produce research that is of interest to the policy community.
A great point.
And I just wanted to add one additional point about the ways that our ambitions before we start writing the Ks may run into the realities of timelines and limited bandwidth. And so when that happens, using the white papers that were written on the advocacy organizations that you wished you had reached out to for a letter of support is a way to start. Telling yourself that you will meet up with them once the K is in and ask for a meeting, or try to make sure to purposefully, find them at a meeting that you'll be at, asking for a letter of support for the resubmission, because chances we kind of always have to plan that we'll be doing a resubmission. The ways that you can continue to say that this is your goal and give yourself self-compassion and slack in working micro ways towards that overall goal will help you not give up when you aren't able to achieve it on your first or even second or third try of actually talking to policymakers as you refine your questions.
I think that's such a lovely final point as we wrap up here, which is that as we have talked about, no one can do this work alone.
Mhm.
We are all in it for the long game. We all need a community. There's all going to be ups and downs. That you can, as Hillary said, give yourself a pat on the back if you sent that one email. It's like really atomic habits, doing a little bit every day, or not even every day, a little bit every month over the long haul, is what's going to really allow you to make an impact. And I want to wrap up by just thanking each of our fantastic panelists, Dr. Hillary Seligman, Dr. Beth Mertz, and Dr. Krista Harrison. I think that, as Beth said, if you're curious as a trainee about how to do this, go back and watch this recording. I know I have learned a ton from this, and it will be posted on our website as per usual. And feel free to reach out to me or to Janet or anyone on this panel if you have specific questions. We really look forward to having you to continue to join us in 2024. More to come in the announcements and on the IHPS website and the Impact website about future events. But we will continue this series monthly and twice a year with longer in-person workshops. And huge thank you to everyone. Happy New Year.
Thank you very much, Beth, for moderating.
Yes. All right. Bye, everyone. Have a good day.
Wonderful. Thank you.